We will continue the theme between Wales and India with the next talk in our program. I will now invite Dr. Nidhika Berry, consultant microbiologist, to introduce our next speaker, Honorable Dr. Harshvardhan, the Union Health Minister of India, who will explain how India successfully managed the COVID pandemic.
Honorable Dr. Harshvardhan, Union Minister for Health and Family Welfare, Science and Technology and Earth Sciences. He's an ENT surgeon who branched out into public life in 1993. He is one of the prime architects of polio eradication in India, and in 1994, on the birthday of Mahatma Gandhi, he organized the mass immunization of 1.2 million children against polio in a single day. He pioneered the implementation of WHO's Essential Drug Program, revolutionizing governmental attitudes to public health care. As the Union Health Minister, his graded, preemptive, and proactive approach has enabled India to decelerate the pace of the COVID-19 crisis in India by strengthening the health infrastructure and building capacity in the fight against COVID-19. He is credited with evacuation of Indian nationals stranded overseas, massive community surveillance, and motivating scientists to come up with Indian-developed vaccines. Dr. Harshvardhan is known for his disarming simplicity in personal life and transparency at the workplace. He is the first Indian to have been nominated to the prestigious WHO body, the Strategic Advisory Group of Experts stage, and is currently the chair of the Executive Board of the World Health Organization. Thank you, sir, for being with us.
Thank you, Dr. Nidhika. I fondly remember that a few years back, when I had visited Cardiff, I had the privilege and pleasure to address all my professional colleagues there in Cardiff and the adjoining areas in Wales. And I also remember Professor Keshav Singhal, who had organized that function along with you. And just now, I am happy that I had the privilege to hear Dr. Vaughan getting your minister in Wales. And I can assure him that whatever he has talked about the relationship between India and Wales, more particularly on the health front, will make it stronger and will certainly adopt a more positive attitude towards this relationship. In fact, you have given me just 15 minutes to describe the success story of India, which is a very tall order. For me to do it in 15 minutes is a real Herculean task, as much a Herculean task as the fight against COVID was. But we feel proud in saying that under the leadership of our great visionary Prime Minister Narendra Modi ji, adopting a whole of government, whole of society approach, we could fight against COVID with absolute commitment, dedication, valor, and whatever you can say. It was a great fight, and at the end of 1 year, we feel quite satisfied about our success, which is definitely much better than most of the countries of the whole world. But we also feel sorry that in the fight we lost our people also. We lost many of our corona warriors, our medical professionals. But their sacrifices, I think they will go down in history of this fight against COVID. And I will start by paying my tributes to all of them. Just to be precise and to run through this story of 1 year in just 15 minutes, I have to tell you that India was the first country in the whole world to have responded within hours of the news that broke on 6th of January through WHO that a new coronavirus has been discovered in China. And within hours on 8th of January morning, we had called our meeting of experts. There we discussed this whole issue and started planning on the same day. And within the next week, on 17th of January, we had drafted detailed guidelines for the whole country. And they were issued to all the states in the country, to all the union territories. And on the same day, we had started a massive exercise of point of entry surveillance, which started with the airports. Then it also was done on the at the seaports and at the land borders. And simultaneously we started a huge exercise of community surveillance. Our first case in India was on 30th of January, a medical student who had come from Wuhan. And we started a contact tracing of the level which I can assure you that nobody in the world may have done that much of meticulous contact tracing, which we pursued and continued to do all through the year. In the first case itself, we had done a contact tracing of 162 contacts. And all this, whatever preparations we had to start, we had done much before. WHO had, in fact, called this as a pandemic of international concern or an emergency of international concern. We had a group of ministers formed very early in the fight in the first week of February itself, headed by the health minister. And this week itself, I had organized the 23rd meeting of this group. There were some 11 empowered groups of the top secretaries of all the related departments of the government. And there were regular meetings which were monitored by the Prime Minister, which were monitored by the Cabinet Secretary, which were monitored by the Health Minister. And if I have to count those meetings, I think their number will go into hundreds. We had a continuous interaction with all the health ministers, all the health officials of the country all through. And at any point of time, I would recall that there were a few lakh people who were under very close surveillance, meticulous surveillance, a surveillance which I think it's you have to actually see that, to feel that, and to imagine the level of surveillance that we had actually done. And this whole setup, when we had started, in fact, we had never thought that we are fighting a battle against a virus which is going to be so wild and which will spread so fast. So we started creating our facilities. You will be happy to know that India, when we started our fight in February, March, we had just one lab which could test the virus in this country. And today, when I am talking to you, we have already created 2,362 laboratory facilities where the virus is tested. We were amongst the first few countries in the whole world where we isolated the virus, and we started stepping up our health infrastructure in the country. And within few months, we in fact had developed over 15,000 dedicated health facilities for COVID, where there were more than 19 lakh beds. And on top of it, simultaneously, we created over 12,000 quarantine centers. When we initiated our campaign, we were short of PPE kits, we were short of N95 masks, we were short of ventilators, and but within no time, everybody rose to the occasion, and we converted that whole situation that into a blessing in disguise, difficulty into the challenge into an opportunity. And within no time, we came to a situation where we were producing 5 lakh PP kits in the country every day. And during the course of the pandemic, we had sent over 400 lakh N95 masks and over 170 lakh PPE kits and over 36,000 ventilators, which we started manufacturing in the country itself. And during the early stages itself, when there was shortage of medicines all over the world, we were in fact exporting hydroxychloroquine to 150 countries all across the world. And then I would like to remind you that this pandemic was declared by WHO on 11th of March. And then we had that historic, most innovative Janta curfew in India on 22nd of March, where everybody cutting across anything that you can imagine, whether it's a political party, whether it's any section of the society, whether it's a child or an old man, 100% people stood like a rock, and they were all supporting that Janta curfew. It was the most innovative thing that was done, and it came out successfully. And at 5 o'clock on 22nd March, everybody came out of his or her house, and they were lauding the role of the COVID warriors, the doctors, and then followed the lockdown, which was probably the biggest lockdown in the history of the country, and of course maybe the world also. Total lockdown and then all those problems that we faced during the lockdown. And if I have to highlight one important thing, that was the issue of the migrant laborers, because they got stranded, they lost their jobs, and there was so much of difficulty. The government ensured that they managed to give food, money, and everything to more than 800 million migrant laborers for almost 6, 7, 8 months. And when there was a need, we in fact sent them to their native places through special trains. Almost 65 lakh of such migrant laborers. There came many situations and many problems like this. And the most important thing that we did was, in fact, we had to teach the society about the COVID appropriate behavior. So the Prime Minister must have addressed the nation, at least if I have to recall the last 1 year, must have addressed the nation at least 8, 9 times, apart from organizing all these meetings. 117 crore people with mobile telephones. We could ensure that all through the 1 year, through a caller tune, they were given the right message through for the COVID appropriate behavior. We created the Arogya Setu app, which is probably the most, you can say, in terms of numbers, the most successful app in the whole world, where 16 crore, that means 160 million people, they downloaded the app, and it gave you a warning if somebody who is either positive or potentially positive comes near you. The Arogya Setu app in your phone will give you a warning, and so many other similar apps were actually created. And for doing all this exercise while we were fighting with COVID, with the strategy to actually test early, to track early, to treat early, and creating all these facilities in the hospitals, simultaneously, we ensured that at least, if I have to, in the initial few months itself, we must have trained during the course of that pandemic over 3 to 4 million workers, health workers, because COVID being a new disease, right up to the grassroots level in a country as vast as India, where there is a population of 1.37 billion people, we simultaneously trained people. How do you fight COVID? What are the norms of fighting COVID? How do you do the isolation? How do you quarantine? How do you maintain the physical distance? And this training program was continuously organized And even today, after 1 year, the training program is being done for millions of workers who are involved in the vaccination process. Then I would just give you an idea that during the initial stages, I would say it's February, March, a lot of experts had come from various American universities and other places, and they gave huge, big interviews to the media here. And everybody said that India is going to be doomed. There is a country of 1.37 billion people. And how will you control it in the villages? How is it going to be controlled in the slums of India? And they had predicted over 300 million cases and 5 to 6 million deaths for India. And today, if I tell you that today I can very proudly say that we have the highest and the best recovery rate in the whole world, that's 97%. Our case fatality rate is just about 1.44%. And the total cases against a prediction of over 300 million cases, 400 million cases, our total cases in India till now in the last 1 year is 10.7 million. And out of these 10.7 million, 10.4 million have recovered. They have gone back home fully healthy and having fought the disease successfully. And right now, today, I have just 0.17 million active cases in the country. I think this is something very unique. From a situation where I mentioned to you about these labs, simultaneously all our scientists, because I hold the charge of the science ministries also, all our scientists, they rose to the occasion. There was a battery of scientists working for vaccine development. There were people working for development of new ventilators, innovative ideas. There were people who ensured that new indigenous testing kits were developed in India. We validated almost 1,000 kits for testing. There were scientists who were working for repurposing of the drugs. And then during the last 6 months, scientists had very actively worked for development of these vaccines. And you know that by now we have already given emergency approval to 2 vaccines, as has been mentioned by your minister also, that one of our vaccine manufacturer is supplying vaccine and making available vaccine for 60% of the, at least the developing world. And today also we are sending these COVID vaccines to at least a dozen countries. We have already started with that. We have got these 2 vaccines. Another 3-4 are in various stages of clinical trials. Maybe another 3-4 months we may have a few more vaccines in the country. From 16th of January, with the leadership of the Prime Minister, these vaccines, our health workers have started getting the vaccines. By first of day after tomorrow, our frontline workers will also start getting the vaccine. In the month of March, everybody in this country above the age of 50 will start getting the vaccine. On the first day itself, we vaccinated the maximum number of people vaccinated anywhere in the world. And today, when I talk to you, we have already vaccinated over 3.5 million health workers in almost 63,687 sessions. And whatever we are doing right now, apart from the things that we did throughout the year, the ensuring that the vaccines are given to the right people at the right time, and there is tracking and recording of everything in the best possible manner. We created a national expert group for vaccine administration in the month of August itself. For 4-5 months, there was continuous meticulous work, training of, again, millions of people at the grassroots who are going to give the vaccines, taking care of all possible precautions, adverse events following vaccination, and then ensuring that we have the most advanced, I say it is probably the most advanced platform in the whole world, which we call CoWIN. Earlier, for our routine immunization program, we used to have a even platform that was a electronic vaccine intelligence network. Now we have, and that used to track the vaccine from one place to the other along with the showing the temperature. Now this new platform that we have created, CoWIN, it also tracks the beneficiary, and the list of beneficiaries are uploaded, and there is a very meticulous automatic mechanism. People will get a text message about when do they get the vaccine, where do they get the vaccine, and when they get the vaccine there on the proposed day, everything is again recorded. It is again given back to them, and then for the second dose they are given the reminder, and then they get an electronic certificate also. So a very I would say advanced platform, a CoWIN platform. And right now we are in fact there's a lot of demand from other countries, especially the neighboring countries, that they want us to help them in various types of trainings for conducting the clinical trials, for developing platforms like this for the whole of their country. So I would say that the whole fight against COVID, it has been, in fact, you see, there are so many things that I can share. Wish you had given me an hour to talk about all this, but you told me that I have to finish everything in 15 minutes. I can tell you that the whole country, every social organization, NGO, scientists, professionals, doctors, nurses, everybody stood up behind the Prime Minister. And we all worked as a team, total whole of government approach. And we worked with a lot of patience, with commitment, dedication, and our doctors, in fact, simultaneously ensured that none of the non-COVID services were adversely affected. During the course of the last 1 year, we even developed telemedicine further as an institutional mechanism, with development and notification of the guidelines, and almost people in the at the grassroots level getting consultations from the topmost in the medical colleges through the telemedicine. All these things were simultaneously developed, and with creation of these facilities, creation of the labs, and then simultaneously ensuring that the best possible research around this virus is also not compromised. We created biorepositories with over 50,000 virus samples there for the students, the university, the academia, and everyone to do the research about the virus. Even for this mutant strain which has come to the various parts of the, I think it's already entered 50 countries all across the world. Of course, it has come to India also. So something like 150, 160 cases are in India also. But we have adopted a very meticulous approach handling these. We were, in fact, doing the genome sequencing at least 6 months back. And we had already sequenced over 5,000 viruses in our laboratories. So even for the development of the vaccine, there's a fund of almost 1,000 crores which has been created. It's called the COVID Suraksha Kavach. You must have seen, if you have all seen the Republic Day parade this year, our biotechnology tableau, it has been awarded as the best tableau which has depicted the contribution of the biotechnology and the scientists and the development of the vaccine in the country. So I don't know if I can continue to talk because of the time constraints, but I would like to uh, thank all of you. And I know that in England the situation is probably a little more disturbed. This is what we hear from the news that appears on the internet and through other sources. But I can only wish you all good health. I know that, like doctors in India, you are also working under very difficult circumstances. But we feel proud that whether it is US, whether it is UK, or whether it is any other part of the whole world, wherever our Indian doctors are there, everybody gives us a feedback that our Indian doctors are working very selflessly with a lot of dedication and commitment, and that makes us feel proud about our professional colleagues, whether they are in API or in BAPIO or in any other country. During the course of this pandemic, I also had the privilege to be nominated as the chairman of the executive board of WHO. Just last week, we finished our WHO executive board meeting, which ran for almost 8 days, 6 hours every day. And we discussed many of the issues related to health. So there's no time to discuss that. And even for the COVID also, we have been every Thursday, we have been coordinating through the WHO with all the health ministers of the whole world, and sharing information and sharing platforms to ensure that we give the best to the people of this world. I have this strong feeling that though it may be called as a year of COVID, but it has been a year of science also. There's a huge contribution by the scientific community. What we are trying to impress upon people in India is again and again through all possible modes of communication is to follow the COVID appropriate behavior. Until the time we did not have a regular vaccine, I had always propagated that the COVID appropriate behavior, that is the real social vaccine. And as long as you don't have the real vaccine, you never forget this COVID appropriate behavior. And the good thing is that this COVID appropriate behavior, which has been followed by people in India, at least it is our observation that a lot of other diseases, which are like airborne or they are transferred through droplets, etc. A lot of them have their incidence has definitely gone down. So we are now entering into a new world with a new normal, and the greatest thing that has happened to the whole world is that health has come to the center stage of politics everywhere. In India also, there is a visionary plan to strengthen the health system, give more budget for health activities. There is no time to describe all that, but our Prime Minister had been otherwise also very passionate about health. We have already launched the National Digital Health Mission in a big way. Our Ayushman Bharat has already made very significant strides, and the Prime Minister has appealed to every Indian to contribute for an Atmanirbhar Bharat. And the results are showing in almost many fields. The economy is getting back to normal. And I can tell you on behalf of our government and what's happening here that very soon, uh, when we get into the 75 years of independence, complete that next year in 2022, we would have certainly given India a new India, which will ensure that there is smile on everybody's face, there is adequate health, education, and nutritional facility for every child, and we can ensure safety of every woman. We can ensure self-respect for every elderly person, and only nationalism and humanism prevail in this country. That's the motto with which Prime Minister Narendra Modi ji is working. And this is his dream, this is our dream, and we are appealing to everyone in this country to also develop a dream on similar lines and blend his or her dream with the dream of the Prime Minister. And we also want all of you also to start dreaming around that and contribute for India's growth and welfare in the best possible manner through whatever modes you can. You have just now mentioned, your Honorable Minister has mentioned about the relationship in health between Wales and India. I look forward to many such strengthenings of relationship, and also your contribution in whatever form you deem fit for the welfare of our own Bharat Mata. With these few words, I would love to thank you once again, Dr. Nidika and Dr. Keshav. I really have nostalgic memories of those few hours or a day or so spent with you in Cardiff. And I look forward to meeting all of you whenever you come to India, with my wishes for your good health and for your welfare, and also the wishes of the Prime Minister Narendra Modi, not only for the medical community, but also for all Indians who live in Britain. I close this talk. Thank you so much. Namaste. Jai Hind. Bharat Mata Ki.
Namaste.
Thank you, Health Minister, for outlining India's impressive response to the COVID-19 pandemic. I agree, you definitely have to come back to Cardiff once we get through this COVID crisis, and describe to us in detail about all the things that India has done. Thank you again for spending your valuable time with us. Thank you. We now move on to the next item. I now invite Mr. Ajay Sharma, consultant orthopedic surgeon, to introduce our next speaker, Lieutenant General Dr. M.D. Venkatesh, who will be discussing medical education collaboration between India and the United Kingdom.
It gives me great pleasure in introducing Lieutenant General Dr. Venkatesh, Vice Chancellor of Manipal Academy of Higher Education. He graduated from Mysore Medical College in 1978 with an exceptional academic record and was commissioned to the Indian Armed Medical Corps, where he served for 38 years. He was the Dean at the Armed Forces Medical College and instituted many cutting-edge technologies in education and medicine. He is credited with many achievements in cochlear implantation and neurology and has published his research extensively. He has displayed inspiring leadership in developing IT infrastructure, research, team building at Manipal University to take it to new heights. He is a member of the Medical Advisory Council of the National Medical Commission. He is member of the General Assembly of Indian Council for Cultural Relations. He is a recipient of numerous honors and awards, including the prestigious Vishisht Seva Medal by President of India. Welcome, Dr. Venkatesh. The stage is yours.
Thank you, Dr. Ajay Sharma. At the outset, I bring very warm greetings from Manipal Academy of Higher Education to all the members of BAPIO Wales. And as I look through the program, I see that I'm the only person perhaps who's speaking on something other than COVID. And I would keep it general in that sense, and also share a little information about Manipal Academy of Higher Education, and also a little about how the internationalization process in India with regard to higher education is progressing, and also the opportunities that the universities in UK and India have in collaborating and continuing our continued relationship. At the outset, I also thank Professor Keshav Singhal and Dr. Hasmukh Shah and all the members of BAPIO Wales for inviting me to be part of this occasion. Just one sec. Yeah. Yeah. Sorry for that small little blip. Once again, bring warm greetings from Manipal Academy of Education, Manipal. The Manipal is a suburb in the rocky hinterland in southern part of Karnataka, about 8 kilometers from the Arabian Sea. The genesis of Manipal is an enthralling story of a genius of late Dr. T.M. Pai, who had the vision of getting society rid of three major ills: ill health, illiteracy, and impoverishment. He started the Syndicate Bank in 1925, Academy of General Education, to propagate general education in the erstwhile combined district of Dakshina Karnataka, Kannada, in 1942. And also, he was the pioneering person to start the first private medical college in India in 1953. 40 years later, Manipal became a university, and in the year 2021, Manipal Academy of Higher Education got the coveted recognition as an institution eminence from Government of India. MAHE, in its collective wisdom, have restructured the organization into three faculties: the Faculty of Health Sciences, Faculty of Technology and Management, Faculty of Humanities and Social Sciences. The Faculty of Health Sciences has about 12 institutes, and we also have two
Dr. Venkatesh, I think we are not seeing your PowerPoint. So I think your PowerPoint isn't moving. We are just seeing your title slide only.
Yeah, we'll just set it right, so one second.
If you wish, I think we have your presentation and we can play it from our end if that's easier.
I think so, sir. That will be better so that the glitch can be avoided.
Kiran, can we play Dr. Venkatesh's presentation? Yeah, what we'll do is we'll play the presentation. We will then transfer the Zoom control to you. So that remote. Okay. Next slide. Okay. If you just let us know next slide, we'll advance the slides.
We'll do that.
Okay.
Yes, yes.
Right, brilliant. I think the slides are coming up. Yep, here we have your first slide.
Yeah. So our Faculty of Health Sciences has 12 institutes, and can I have the next slide, please? Next slide. It's not moving there. Is the slide moving there, please?
Can you see our screen?
Yeah. We are seeing your screen. Yeah.
Oh, good. Yeah, we can see your screen perfectly.
Okay. Can we go back on one slide? Just go back on one slide. Yeah. The Faculty and Technology and Management has 7 institutes and 6 departments, and the Faculty of Humanities. Next slide. Humanities had liberal arts, social sciences, and in one school, and has 6 departments. And we have to move forward, sir. The slides have to move forward.
They are not happening. It's happening.
Is that the one you want?
Yeah. Can I have the control from there?
Yes, I think you can.
Just try to move the slide.
Right, we're just giving you the transfer control. If you'd accept,
Sorry for this.
advance the slides. Right. Have you got the control now? Yeah.
Yeah. Okay. You know, I don't think I'm able to move the slides.
Okay. I think we may have. Normally, you should be simply by either page up, page down, or the arrows. You should be able to move it up and down. If not, we can go back to next slide, I'm afraid.
Yeah, we will go on to the next slide. So just a brief this thing that Manipal Academy of Higher Education, as I mentioned in the previous slide, can you go back? The previous slide is one of the highest ranked private universities in the country, and also has a very decent international ranking. And we have a student strength of close to 30,000 students in our campuses, which is spread across 3 major campuses in India and 2 campuses abroad. Can we go to the next slide? Yeah, MAHE partnership with UK universities. MAHE world over has over 220 universities which are collaborating with us. And in the UK, we have more than 20 universities who are in collaboration with us in research, in education, in pathway programs. Collective priorities. Yes, please.
Please carry on.
Yeah. The collective priorities suggest that the common thread linking most of the universities is the demand for mutual recognition agreement, supporting student recruitment and institutional partnership. MAHE insists on greater research collaboration with all its university partners, as you can appreciate how MAHE and UK universities have benefited from collaborative research and joint publication. Just to drive home a point, MAHE, close to 30% of MAHE's publications has got international collaboration, and a significant number of them with the partnership with UK universities. Therefore, there's a great potential for us to take this collaboration forward. Can we have the next slide, please? We are looking at opportunities for collaboration in Wales. You know, there are 8 universities in Wales, and I wish to place on records the intentions of MAHE to collaborate with each one of them. With all the 8 universities offering futuristic courses and promoting cutting-edge research, country has a long tradition of academic excellence, and MAHE would welcome collaboration with all the universities. We have a robust mechanism to foster international engagement for higher education, generating an effective and superior research collaboration, facilitating staff and student exchange, offering bespoke training, and establishing long-term sustained partnership with universities of repute in Wales is ingrained in our mission statement. I am pleased to inform you that these are potential areas of research and collaboration at MAHE in the Faculty of Health Sciences in the field of emerging infectious diseases, cancer oncology, nanotechnology, drug delivery, geriatrics and gerontology, public health, lifestyle disorders, and drug discovery. We are exploring opportunities to expand our international network and would welcome expression of interest from universities in Wales to collaborate and cooperate with us in the entire range of internationalization, from student mobility right down to research, publication, and joint grant writing. Next slide, please. Yeah, on the silver jubilee of BAPIO, MAHE extends its warm greetings. I congratulate the British Association of Physicians of Indian Origin, BAPIO, on its silver jubilee anniversary. An organization that was established to support doctors arriving from India to work in the NHS has indeed grown in stature and influence. I congratulate the doctors, dentists, medical and dental students of Indian heritage, along with all others, for selflessly working around the clock for promoting professional excellence and leadership through BAPIO's 4 channels: policy influence, education and training, advice to individuals, and global health and charity. I wish you all continued success in your efforts to promote access to better healthcare globally. Can we have the next slide? BAPIO has rendered yeoman service in nurturing young doctors and aspiring healthcare workers from India by collaborating closely with the General Medical Council, Health Education England, and the Royal Colleges. An organization, no matter how well designed, is only as good as the people who live and work in it. The nation counts on you, sir. India looks forward to your continued action in India towards helping our graduates and other healthcare workers toward finding quality training and suitable employments in United Kingdom. Next slide, please. During this pandemic, another very grave, important event happened in India. Despite the pandemic, in the month of July, the Government of India announced the new National Education Policy 2020, which perhaps is one of the most comprehensive education policies documents in the world. It covers the entire gamut from school education to higher education to professional education to technical education to adult education to vocational education. The entire gamut has been covered. It's a very, very comprehensive document with a very, very ambitious endpoint, which has been defined as taking India's GER, that is gross enrollment ratio in higher education, to close to 50 by 2035. Some of the important things, this particularly is about the objectives of internationalization, to attain global quality standards, attract greater number of international students, opportunities to, some of the important opportunities that are there in the national education policies are to transfer credits to or carry out research at institutions abroad and vice versa, and counting for the award of degrees. And to offer courses like Indology, Indian languages, Ayush system of medicine, yoga, arts, music, history, culture, etc., to bring in a holistic element into the higher education. The purpose of internationalization is to collaboration with high quality foreign institutions to facilitate research and teaching and exchanges. And expansion plans which have been envisaged in the new national education policy is to permit high-performing Indian universities to be encouraged to set up campuses in other countries, and those from among the top 100 universities in the world will be facilitated to operate in India. Next slide, please. And some of the, the reforms and role for UK would be that if you look at the number of universities in India, it's close to 1,000 universities with close to 40,000 colleges, with almost 11,000 standalone institutions. Total enrollment is about 37.4 million. Currently, the gross enrollment ratio for females is about 26.4%, for males is about 26.3%. What is glaringly disproportionate is there is 80% admission to undergraduate programs, whereas in the postgraduate programs and the postdoctoral enrollment is only 11% to 5%. I think here is where there's a tremendous opportunity, especially in the field of health sciences, medicine, and other allied health and other things, that there could be a big role for us to play, and a big role for us to play between UK and India. And again, a disparity is seen amongst the inbound students and the outbound students, and the Government of India wishes to bridge this disparity and get more and more inbound students to India going as we go forward. Next slide, please. Can we have the next slide? Hello? Yeah. India-UK Education Connection, the creation of India-UK Education Connection by British Council is a very, very welcome step. This bilateral 3-year program between 2019 and 22 is aimed at developing innovative education and English projects in India, building institutional capacity and contributing to systemic changes. Through this program, the British Council will create and co-fund projects and interventions with Indian central and state government, partners and universities, and involve engagement with UK organizations to bring in mutual benefits to both nations. Building mutually effective higher education collaborations between UK and India shall improve the skill base, investment, trade flows, and generate more jobs and prosperity in both countries, which is in alignment with our new national education policy. Next slide. The UKRE study in India. Education is an area where India and UK could pool some of the advantages for mutual benefit. The launch of UKRE study in India, which supports UK universities to collaborate with Indian partners to send UK students to India during their studies, is a fascinating initiative by the University of UK International and British Council. This program will be funded by UK and Indian governments as part of Phase 3 of UK India Education Research Initiative and delivered by British Council Universities UK International, and Educational Consultants India Limited. In fact, I'm happy to state that Manipal was successful with 6 UK student mobility grants in its maiden call, 2 with Portsmouth University, 1 each with University of Sheffield, Aberdeen, Edinburgh, Napier, and King's College London. This high percentage of success in a single call, besides supporting internationalization of Indian higher education through interinstitutional partnership, provides a big roadmap for future collaborations. And this mobility also promotes employability of UK graduates, and it produces globally competitive workforce. Next slide, please. In a study that was conducted, some of the benefits and barriers in Indo-UK ties were identified. There are complementaries between UK and India's education ambitions, but there are significant access barriers. Both the governments have to address it as a priority so that the opportunities can be realized. Research and knowledge enhancement are the most frequent benefits. Likewise, student recruitment from India can benefit UK universities by improving the diversity, culture, and student experience. There are a range of barriers that have limited UK-India higher education collaborations. The government policy needs to reform in the United Kingdom and in India, with immigration policies and, most importantly, mutual recognition of qualifications being the most common issues which have been identified. The reinstatement of a 2-year post-study work visa period, which the UK government has now committed, has come as a huge relief to many Indian students. Can we have the next slide, please?
I'm sorry, Dr. Venkatesh, we had a bit of a problem at our end, right? So just check and see which slide you need to be at.
Yeah.
Yeah, we'll keep going until you tell us to stop.
Next. Here we go. Next. Yeah, here we were. Just listed out some of the benefits and barriers. The 4 verticals of Indo-UK Living Bridge is quality of teaching, quality of training, quality of research, capacity building and online learning platforms, digital literacy and physical access to internet ICTs, industry, university, academia partnership, upskilling and lifelong learning. These are some of the 4 verticals in which the partnership can progress and reach the next level. Can we have the next slide, please? Next. One slide back. Yeah, the next slide. Yeah, Manipal Academy of Higher Education and British Council have signed an agreement to make International English Language Testing System, IELTS, available to students on campus in Manipal. This is something which is very, very unique. And I'm sure as we go forward, many other universities will develop such language testing facility, which will promote more students and more professionals to get into UK and start working training there. Can I go back to one more slide, if you don't mind? Yeah, this is the one. Yeah, next slide. Next slide, please. Sorry for this. No. Go forward, please, forward. Yeah. Yeah, can we stop here? We have also signed an MOU with Health Education England. This is something which is already bearing a big fruit, emphasizing the need for high quality patient care. MAHE commissioned first Global Training and Education Center, GTEC, in collaboration with World Health Education England. With the inauguration of the Global Training and Education Center, MAHE has pledged to open up global medical programs for doctors, global learners program for nurses, global English school for healthcare, clinical communication wing, objective structure clinical examination training program for doctors and nurses, and general medical council remediation program for doctors. BAPIO International Fellowship Program in collaboration with Royal College of Physicians, Edinburgh, and Health Education England is really exciting, and it is heartening to note that this training initiative is designed specially to help international doctors gain experience at the core and higher level in UK hospitals. I'm sure this model could be replicated across many other universities, and MAHA in its own is already promoting this to be implemented in one of its sister universities, that is Sikkim Manipal University, so that qualified health professionals can have an easy migration access to UK for training and for employment. Can we have the next slide, please? Next slide. I think I spoke about IELTS training. The United Kingdom Business Council higher education recommendations, some things which is very, very critical as we go forward is mutual recognition agreements for foreign qualification. I think this is one of the biggest barriers, especially in health sciences, medicine, and other related specialties. Therefore, it's important that we need to look at having mutual recognition for qualifications in either countries to study, to undertake training, and also practice our professional wares in either of these countries. There's also a need to look beyond universities' overall ranking for international collaboration. This is something that is very critical for us to improve international collaborations in this entire range in terms of student mobility, faculty mobility, research collaborations, joint grant writing, joint publications. All these things can only happen when there is more and more widespread collaborations between universities in UK and in India. Often some of the universities would look at only collaborating with higher ranked universities. I think this needs to change a bit so that there is a more widespread and far-reaching collaborative arrangements so that the benefits could accrue to both the countries as we go forward. The other important thing that we need to look at is to promote education delivery adapting technology in online modes. This perhaps is very, very important, especially in health sciences, when you're looking at faculties who are unable to move across the countries, be available as adjunct faculty, as affiliate faculty, and be able to take the academic delivery through online mode. So this is something that we need to adapt. And I think COVID has taught all of us how to adapt to the newer technologies and make it productive. As I foresee, I think going forward, the campus-based education program, though, will become the backbone of most of the education delivery. There would be a significant place for online education delivery and also a blended mode of educational delivery. And something which is equally important is support a university-to-university dialogue on university social responsibilities. So the government should also make employability skills for graduates a top priority and integrate vocational skills with mainstream education. The governments should also stimulate and support a university-to-university dialogue. And more and more emphasis should be paid towards university social responsibilities, towards helping the universities across the globe to collaborate more, to communicate more, and also to deliver more in improving the quality and productivity of each of these universities with the aim of bringing health for all a reality as we go forward. Next slide, please. And as I see the future perspective, education will be vital if India is to reach its economic goals. And I would emphasize that India will need support from UK to educate its huge and growing student population. By 2030, India will have the largest number of people of college-going age, a staggering 140 million. And India has more doctors than it can offer postgraduate training. This is a very significant gap between doctors with undergraduate qualifications and doctors with postgraduate qualification and super specialty qualification. And we all know that UK has vacant training spaces. Both the countries can complement each other and learn a lot from each other. Being able to share students, staff, best practices, teaching and research material not only results in better education, but it will bring our societies closer, which has always been close, but it will bring them more closer, strengthening the living bridge that binds UK and India. These priorities align very well with Government of India's ambitions of India's higher education sector is set out in the new draft education policy. I'm sure there are plenty of opportunities with the new education policy liberalization as the governments are looking at, and more universities will collaborate, especially in the field of health sciences, in the field of medicine, towards having more and more mobility, more and more research collaborations, more and more joint grant writing towards creating new knowledge and towards developing newer skills and enriching each other's healthcare to a greater extent. I thank once again BAPIO Wales for giving me this opportunities, and I wish BAPIO Wales all the success in all their endeavors in future. And I would assure from Mahe that we are always available. We are very open, and we are looking forward to internationalization in a very big way. And we would look forward to collaborating with universities from Wales in a very positive and promote this cultural and educational exchange to take it to the next level. Thank you very much, and Jai Hind.
Thank you, Lieutenant General Dr. Venkatesh. It was very interesting to see what the degree of collaboration in education between the two countries. I think there's clearly, as you say, there's scope for a lot more than what we currently have. Thank you again. I now invite Mr. Rahul Kotwal, Consultant Orthopedic Surgeon, to introduce our next speaker, Stephen Doty, MP, who will provide us with a global perspective on COVID-19. Rahul?
Good afternoon, everybody. I would like to invite our next speaker, Stephen Doty, Labour and Cooperative MP for Cardiff South and Penarth, and currently the Shadow Africa Minister and a member of the Home Affairs Committee. He was born in Cardiff, brought up in the Vale of Glamorgan, and has studied in Canada, Oxford, and the University of St. Andrews. As an MP, he has campaigned for justice for the poorest and the most vulnerable, and has worked on wide-ranging topics such as HIV, AIDS, climate change, mental health, and education. Ladies and gentlemen, please welcome Stephen Doty to give us a global perspective on COVID-19.
Well, thank you so much for the very kind introduction, and can I thank BAPIO both locally and nationally for all the incredible work that you do, and it's great to see so many friends and constituents on the call as well, and particularly want to thank Keshav and Haz and all of the others who have developed the relationship over so many years, and I'm really proud to work with you and to know you, and I want to thank all of you on the call today because without all of you working in our NHS, not just in Wales, but across the UK, in our care, in our scientific sector, in clinical research, so many areas, we would be in an even worse situation than we are today. And so I want to thank you personally on behalf of my constituents in Cardiff South and Penarth, as well as on behalf of many of my fellow parliamentarians across the party lines. You know, what you do is absolutely incredible. And having spoken to many colleagues working in the NHS over the last few very difficult months, I've heard firsthand some of the incredibly difficult situations that you've had to deal with, and quite frankly the heroism and courage that so many of you as individual staff members and others have shown in your work in the NHS and more broadly. And obviously this week we've seen a very tragic milestone reached at a UK level, over 100,000 deaths, devastating impact in Wales as well, and in my own constituency. But of course, we also see some of the signs of hope in declining cases, declining hospitalizations, and of course, the vaccine delivery program. And, you know, again, I want to pay tribute to all of those involved in that, locally, particularly the remarkable acceleration that we've seen and across the UK. And as we mentioned, I've had long-standing interests in international development and global health issues, as well as being a shadow minister covering those issues. I previously worked at the Department for International Development, and I also chair the all-party group on HIV and AIDS, and previously worked with Oxfam International on their global health programs with colleagues from around the world on global and public health issues. And I think, the comments from my constituency colleague and of course our health minister in Wales, Vaughan, and also, fantastic to hear from Dr. Vardhan, Minister. They both have spoken incredibly powerfully about the need for international collaboration, not just on COVID-19 and the response, but on health and science more broadly. That absolutely must continue. And I think the incredibly vital partnership that exists between Wales and India, which has been so powerful for us and the world, whether that's in terms of people, expertise, science, manufacturing. Vaughan mentioned the role of the Bocart factory in North Wales, Serum Institute, so critical for the developing world and generic medicines and expertise, but also that cooperation through the WHO and other bodies. And I want to congratulate Dr. Vardhan, the Minister, on his appointment as the chair of the committee. These partnerships are absolutely critical. And obviously we've seen some very positive developments globally in recent weeks, new vaccines showing promising results, collaboration between science and clinicians across the world. And of course, in the global political sense, the election of the new US President Joe Biden, returning the United States to the WHO is very, very welcome, reversing the very dangerous and ignorant agenda set by Donald Trump. But you'll have all heard what WHO Chief Dr. Tedros has said about vaccine nationalism, about the risks of a moral crisis, as well as the huge health and economic impacts. And I know he's been speaking at the Davos Virtual Summit, explaining that vaccine nationalism and not cooperating will keep the pandemic burning, slow global economic recovery, but also it would be a catastrophic moral failure. And we've seen unfortunately some elements of that overnight, a very regrettable situation developing yesterday evening with the European Commission, which thankfully that they have stepped back from. And I think we need to take great care and think of the greater global health, economic and political good when we're considering some of these very, very difficult issues. But beyond the issue of vaccines, obviously the pandemic has been devastating globally, 100 million cases, 2.2 million deaths, and that's before we even look at the impacts of long COVID and otherwise. And I've been speaking with many clinicians, development specialists, scientists, and political figures across the world over the last few months, particularly in recent weeks with the head of the African Union Centre for Disease Control, Dr. Nkengasong and his team, as well as some of the other leading virologists, health workers and others. And I've also been speaking to people on the front lines in health services around the world, from Sierra Leone to India, who've been giving me the very reality of what is happening and some of the challenges that they're dealing with, but also some of the incredible innovations and developments that they have undertaken to deal with the pandemic in their own countries. I just wanted to touch on 2 or 3 key issues and some key challenges going forward globally. I think firstly, in terms of the challenges, we obviously had the direct impacts of COVID, and there are many, many competing trends going on here. Obviously very devastating impacts in some locations, but in others we have seen perhaps not as big an impact as we would have perhaps expected. So when we look at, for example, the sort of the paradox really of some of, for example, of the countries across the Central African and East African belt, perhaps far lower levels of hospitalizations and deaths than we would have expected. And there's a very interesting article from Dr. Nkengasong and Dr. Maeda, his colleague from the AU CDC, that I'd recommend to you on this. And there are many different hypotheses which they're currently testing. It could be to do with the population demographics and youthful populations. It could be to do with acquired immunity from exposure to other disease, parasites and others, and a whole series of other factors. And it's very important that we understand those. But there are countervailing examples. I spoke this week with the health minister for Malawi, a country again which has close associations with the UK, with Wales and with Scotland in particular, and heard a pretty devastating story there of how in this second wave they're seeing a much greater rate of infection, hospitalizations, huge pressures on hospitals, inability to access piped oxygen, for example, to respond immediately. And also we need to understand what has really happened with the virus. There's been studies, there's a study by Yoga, which I'd recommend, where they've undertaken serology studies in Kenya, for example, that estimate that the levels of infection are actually much higher than are apparent by the testing rates. So, for example, their evidence from serology studies suggests that in fact there have been 2.2 million possible infections by COVID-19 in Kenya. and that's compared with the officially reported rate, which I think is around 80,000. So we need to understand fully what is happening. Second issue really is the secondary impacts on health systems and care. I've been struck by the examples that I've been given both by global bodies, but also by individual country representatives and health workers, that some of the things that we've seen happen in other disease outbreaks, for example, the Ebola outbreak recently, which led to actually in some areas increased deaths from other diseases, whether measles, HIV, TB, increased rates of maternal mortality, that we are seeing, of course, again in this scenario. And I work specifically on HIV, and I think it's worth reflecting that even in 2019, with the treatments that are available, with the testing, with the knowledge that we have, we still saw 1.7 million new global infections for HIV in 2019 and 700,000 AIDS-related deaths. And UNAIDS and bodies like the UN Global Fund that I work very closely with have estimated that we could see 500,000 excess AIDS-related deaths in sub-Saharan Africa alone as a result of the additional pressures on health systems, the diversion of resources, inability of people to access antiretroviral treatments, testing, therapeutics and others. And of course, the lockdowns in many countries have impacted on people's ability to access other parts of health services. We've seen that, of course, impact in our own country, but of course, we're seeing this hugely globally, similar impacts with TB and otherwise. Thirdly, the tertiary impacts on economies, on conflict, on already fragile societies. We see some governments using COVID as a cover to abuse human rights of particularly marginalised groups and to deny access to healthcare for certain groups, or in worst case scenarios, extremist groups, whether it's ISIS, Al-Shabaab, others, some very, very worrying evidence that they're using the fragility and chaos caused by COVID to pursue incredibly deadly agendas. And of course, the devastating impacts on already fragile economies could last for many years. There will be huge economic, social and political consequences with that. And of course, that is very varied depending on the approach that individual countries have taken. Taking Africa, for example, the AUCDC has done remarkable work, I think, in increasing capacity. There's been huge collaboration between a number of countries and really incredibly positive work, much that we can learn from as well. But in some countries, I give Tanzania as an example, very limited non-pharmaceutical interventions, a lot of COVID denialism, and yet the virus undoubtedly spreading through populations. So some really serious challenges. Going forward, some key things. I think firstly, all of this, and this has been reflected in some of the other presentations, reflects why we need to invest sustainably in global public health capacity and all that goes around it, and not just in individual products such as vaccines, but in every aspect of our health systems globally. We need to invest in things like surveillance, in diagnostics, in domestic production capacity in many locations. What one of the leading virologists said to me, you know, some of this is traditionally been seen as the not sexy stuff, but we've got to do it. Zoonotic research as well, understanding those links between human to animal transmission and vice versa. You know, getting the basics of being able to have enough reagent supply in a country to be able to undertake research and testing. And of course, we see these threats from new variants. You know, surveillance will be absolutely critical, that genomic sequencing capability and otherwise. And there's some really important work that the UK is doing globally in Africa and elsewhere, and working with those to share some of our expertise, which I think is hugely welcome. And in Wales, we have some particular excellent expertise on this, and I hope new partnerships and collaborations will happen. And of course, we have to see the training and resourcing of public health systems in countries worldwide. You can have vaccine, you can have therapeutic treatments, but of course, if you do not have nurses, doctors, facilities, coordination, cold chain capacity, then you are obviously not going to be able to have the impact that you need to have. And there is a huge amount that we can do working together globally on all of those things. These are arguments I've been making for many, many years, and I hope that we will see global sustained investment in public health systems. Three challenges to finish with for the UK specifically. Firstly, whilst we've seen some really brilliant support globally, the UK has decided to cut its aid budget. It's decided to abolish the Department for International Development. I think that's a huge mistake in the middle of such a global pandemic, and from an agency which has played such a key role on global health. Health, the UK government say, is still a key priority, which is welcome, but we need to see that turn into actual action. You know, are we going to maintain our commitments to the WHO, the UN Global Fund, fantastic programs like IAVI, CEPI, and others? It is absolutely critical that we do that. Secondly, we need to invest in that scientific, technological, and political collaboration. Thirdly, we must not lose the focus on those other diseases and health challenges, because otherwise we will see an additional hidden toll in the millions on top of the direct deaths from COVID. And lastly, I think, and we all have a challenge on this, and this has been very clear in many of the conversations I've had globally, is misinformation and fake news about vaccines, about health, about any disease. And we saw this tragically in the HIV epidemic. We see it for many other diseases, and we are tragically seeing it over COVID. And this is a global challenge for tech companies, for media, and for political leaders. And what they say and what they do matters. And we've seen brilliant examples of leadership globally on that, and we've also seen some very poor examples of leadership on it globally, and the cost of that is in human lives. I know that all of you on this conference today recognise these global challenges. You've shown that by your lived example and the work that so many of you do, and I hope that we will continue to see this as a global challenge, a global fight for humanity, and that beyond COVID we will see global cooperation on health, science and technology going forward.
Thank you. Thank you, Mr. Doty. That was brilliant. I think you've given us a much, to look at the bigger picture. That the impact of COVID-19 is not just the medical impact. There are a lot of other impacts that that will be the effect of the COVID pandemic even after it's over.